But let's get right into our topic today, healthcare. The best business opportunity in America? That's a question, right? Because a lot of people are not aware that there are hundreds, literally hundreds of different types of businesses that are out there. So I'm going to turn on my camera today just so that you can see me live. Those of you who are live on the webinar, those who are watching the recording, it doesn't record the video at the top there. But I do that so that you can see that it is a live webinar, and I'm going to be turning off the slides from time to time and just letting you talk to me directly through the question box. So let me get that here out on my screen so that I can see those questions as they come in. I see some other people have shown up here as well, Kathleen and Shirley and Tony. Thank you for putting your names and city and state there in the question box as well. Okay, but I'm open to those questions. You can type them in anytime you want to throughout the webinar, and I'll try to address those as they seem pertinent to what we're talking about. Let me start out with healthcare itself, and I do that by showing you something that I had to kind of paste together here out of a two-page spread in Inc. magazine. And again, for those of you who are on the live one here, I think I have that magazine even somewhere right here. It is. This is the September 2015 issue of Inc. magazine. You can find it on the newsstands right now. And inside there, it looks like page 26 down in the bottom left-hand corner there, you'll see this chart. It's a great view of all the different industries that you could get involved in if you wanted to start your own business. And some of them are huge. Look, there's real estate is $734 million. Travel is $28 million. Computer hardware is $96 million. Insurance, $163 million. It just goes on. And you'd think some of these are just much, much bigger than the healthcare. But if you look at the chart carefully, you'll see health right here. I'm circling it here with my cursor, and you can see that it is $2.1, not million, billion dollars annually. That's why this curved part of the chart is the largest curve here, the highest one. Now look over on the left-hand side. I know this is probably hard to see on your screen unless you really get down there and look at it, but notice the quote here on the left side. Healthcare is not only a huge part of our gross domestic product, that's 17.4%. Folks, that's a huge part of it. It also remains a prescription for growth and new jobs. Revenue for the Inc. 500 companies in this sector jumped 64% last year. So, folks, pause just a second and let that sink in. If you're thinking about getting into any business sector, wouldn't healthcare be one of those that you would want to at least consider? 64% increase from the previous year. And then look, here's the most important part right here. It says that trend should continue. Now, why is that? Well, it's because healthcare is just one of those things that will always be around as long as they're human beings. Human beings get sick. Parts stop working. You go to the doctor, and as you get older, of course, you go more often. There are 10,000 people who are retiring, baby boomers they call them, and getting into Medicare every day in the United States. So it's just a huge industry to get involved with, and that's why I wanted to tell you about that. Kathleen's asking what issue that is. If you look down the bottom left-hand corner here, Kathleen, you may or may not can see that on your screen, but it's September. It's this month, September of 2015, Inc. magazine. Be sure and pick that up. We've also given you guys, by the way, a printout, a PDF of all of these slides. If you look over in your control panel there for GoToWebinar, it should be listed there under handouts. And so you have a PDF there that you can download right now if you want to. Open it up on your computer if you want to. Just don't stop paying attention to what I'm doing over here on this screen as well. Now, I also wanted to show you a book. I have it here on my bookshelf right behind me. This is called Healthcare. I don't even see it right now, but I've got a picture of it there. It's from Entrepreneur magazine, which has been around for 30 some odd years. And this is one of their startup books on starting your own medical claims billing service. And folks, I show you this because in the back of the book there's an appendix that lists all sorts of things like books and resources and websites and things. And we're listed right there in the book under business opportunities. The only other company that's listed there was one other company that's gone out of business. So We didn't even ask to be put in that book. We just opened the book one day, and there it was when we bought the book. Shirley says she does not see the handout PDF. Now, this could be hidden. Again, this is a brand new feature of GoToWebinar, so I'm not sure how that works. Look for all those little things that say, one says audio and polls, and I don't know what all is there. One of them should say handouts. If not, Shirley, you can ask your ABS representative to email that to you as well. Okay, so what is medical billing? Let me just kind of boil it down real simply. Some of you may have seen a form that looks like this one here on the screen. It's a red form. It's created by Medicare. It's called the 1500 form. I'm showing you this because not that you would be doing it on paper, of course. Ours is electronic, but you can see that there's not that much information that has to be put into a computer system to get an insurance claim filed. There's information about the patient, of course. There's some information about the insurance company. And there's some few codes that the doctor gives to you to put in to do the billing. So if you can fill out this form right here, even manually on a typewriter, you could probably do that in, 4 or 5 minutes. Electronically, it can be done much quicker than that, and of course it retains all that data, so the next time the patient comes in, it's already there. And all you have to do is put in some new codes, basically. But that is how simple this business is, folks. People try to make it difficult. Online, you'll see all kinds of courses and books you can buy on doing medical billing and coding. Folks, you don't have to know anything about the coding because the doctors give you those codes to put in. Now, if they don't know what the codes are, maybe they're brand new, we have certified medical coders that for a fee that you pass on to the doctor can give you the exact codes that the doctor needs. But most doctors, if they've been in practice any period of time, have been using the same 2 or 3 dozen codes their whole practice. Now, when we talk about those codes, by the way, there are literally thousands of codes. There's books this thick that show those codes. But again, that's for all the different medical specialties. For any particular practice, like maybe a general practitioner, they might have, again, what you see here on this page. It all fits on one piece of paper. They call it a super bill. And you've probably seen something like this when you go to the doctor. Well, all the doctor is going to do is he's going to circle the codes that are for the visit and the codes that have to do with the diagnosis, and then a code that maybe what they've done for the patient, a procedure code they call it. So 3 or 4 codes is all you put in for any one insurance claim. Again, folks, from a time standpoint, you can put a brand new claim in from scratch within 4 or 5 minutes, and if it's a repeat patient, which it wouldn't be the next month, right, all you're going to do is put in the codes. Literally takes you less than a minute to generate that claim electronically. Now remember, I'm showing you paper here, but you're going to be doing it electronically. Robert says he found the handout, and Shirley says she found it. Okay, good. David is saying, yes, this looks very easy. Mark is here from San Jose, and Tony says, Patrick, if you don't need to know the coding, what is it exactly you do need to do to process the claim? Well, I'm going to show you some screenshots here in just a moment to show you how simple that is, Tony. Literally, you're putting it into our software, pushing a button, and the claim is filed. We have our own clearinghouse that's built into our system. It doesn't go to a third-party clearinghouse like a lot of medical billing software does. Ours is cloud-based, so it's in real time, and it's that simple to push a button and literally it's gone, and sometimes it can be paid within the same week. Now, we talk about medical billing as the business that you're going to be in, but folks, we basically train you and certify you as what's called a medical revenue manager. That's right, you get a designation, a CMRM is what you can put after your name on your business card and on your website. You are a certified medical revenue manager. Now, why do we use that term? Because it's not just the medical billing of an insurance claim that has to do with the revenue that comes into a doctor's office. Look at this chart here on the left side. You can see that it includes receivables, reimbursements, electronic records, payment options for the patients, coding, of course, and even marketing for the doctor. Yes, we teach the doctor how to market their practice and grow their practice. So all that's involved in the revenue cycle, a doctor calls it, the revenue cycle. And we're going to show you how to become a medical revenue manager to help manage all this for the doctor. Let's see, here's Dale, he's in Las Vegas. Shirley says, how long would it take to get a doctor and to get your business off the ground? That's a great question, Shirley. Let me just say it this way. For most licensees who go through our week-long training here in Dallas, they'll get it within 30 to 90 days. Now, that may sound like a long time to you folks, but believe me, one doctor can earn you, $30,000 to $40,000 a year. So you don't need a whole lot of doctors to make a real good income from this. And even if it took you 90 days, even if it took you 6 months, wouldn't that be worth it? Because once you have that doctor, the doctor sees patients every month, right? And so it's a residual income for you. Every month you're doing the billing. Every month you're billing the doctor for the percentage that you're charging him, and you get that from the doctor each month. As long as the doctor's in practice, unless he sells his practice or dies. Let's see. Donna found and printed the handout. Good, thank you. Nikhil says, how much does it cost for your clearinghouse? Well, Nikhil, if you've looked at other software that's out there, most clearinghouses are going to charge anywhere from 30, 40 cents up to $1, some of them. But there is no charge for ours. Remember, it's built into our system. And so you're not paying per claim. Every claim that you send, it doesn't matter if you send one claim or 100,000 claims a month. There is no cost. David says, would this be the position title for tax filing? You're talking about the CMRM. David, I don't really know what you'd use on your taxes. You don't really have to even use this title, but you would tell them that, yes, I am a medical billing specialist. That's probably what the IRS would understand on a tax form. Robert says, what are the viable alternatives for the doctor's office to perform this billing function? Oh, well, there's only two, Robert. In a doctor's office, they're either doing it themselves using their own software and their own staff, of course, or they've already decided that it's wiser to outsource that to somebody who knows what they're doing, who does it every day, maybe for several doctors, and not depend on their staff keeping up with the changes and the education that needs to be there to stay on top of this industry. So that's their only viable options, really. And we can show you that you can actually save the doctor money from not having to use his own staff and keep up with his own software and his hardware and software updates and all that type of stuff. So basically, it's this simple, folks. What you see here is what I referred to earlier, the revenue cycle. The revenue cycle includes, of course, the patient registration and the eligibility, checking the eligibility for the patients. That's called the claims preparation. That's done in the doctor's office. And by the way, they can use our system to do the eligibility check live, online, in real time. We have a scheduling system built into our system, and it's just wonderful when you see this done. We can do a live demo for you, folks, if you'd like to see our system, by the way. Then the claim submission, that's done by you. Once they've put the data in or given the data for you to put in, and it's registered in the system, then you're going to submit that. Then, of course, there's claims management. That means when the payments come in, it has to be posted. You're managing that along with the doctor's office. Since it's a cloud-based system, you can give them access to it so that they can do that posting. Then the denial management is a part of what you'll do for the doctor. Remember, I shouldn't say most, but a huge number of claims that the doctor submits are denied by the insurance companies for one reason or another. Sometimes it's human error, sometimes it's just the fact that it's missing some data. But you'll be able to manage that with our system because it'll tell you exactly why the claim was denied and allow you to fix that. Then there's AR follow-up, meaning there are some patients, of course, that are billed through our system that may not want to, they may not pay their bills on time. We have a built-in automated system. You don't ever do any phone calls or collections. This automated system collects that for you, and of course from the insurance companies as well. Patient collections, that's what I just mentioned. Reporting, that's all a part of our system. And here's the great part, folks. You can print the reports and provide those by email to the doctor or on paper if you want to, once a month, along with your invoice for the billing. Or you can give access to the doctor to that part of the system where they can see the reporting for themselves live at any time. Let's see, I'm just going to go back to the questions from time to time here. Mark says, aren't most of the doctors already farming out their billing services? In other words, outsourcing it to a current billing company. What would be the competitive argument for them to switch to us? That is a great question, Mark, and I don't even know where to begin on that. All I can say is that most of our licensees from coast to coast are signing up doctors who've already decided to outsource it to another company. Believe it or not, a lot of billing companies are using outdated software. Their system is not designed to get the denial rate down. For a lot of medical practices and a lot of billing companies, it runs 20 to 35% rejections, denials. Ours, nationwide, is less than, you ready for this? Drum roll, please. Less than 2%. That's right. You could take a doctor's rejection rate for their claims from 30%, let's say, down to 2%. That's extra money in their pocket because most of those claims never get refiled. Let's see. Kathleen says, how do we move the doctor from his current outsource entity to our system? Well, it's real simple. If the doctor is currently using the system, we can import that data, the patient data, the demographics it's called, into our system. If they're using another electronic health record system, they can continue using that and let you do the billing through our system, or we can import that. Now, there's a fee for that, of course, because there's a lot involved in trying to match up one system with another. But as long as their system is what's called HL7 compatible, compliant, then ours can read that data in. Robert says, do any of the large healthcare providers use the ABS system? Is the target client for ABS the private doctor's office? You know, I probably didn't make this clear, Robert, but we as a company don't do medical billing. We do not use the system I'm talking about. That is licensed to you. That's why we call our folks who've invested in our business opportunity licensees. And you have the license to use our system to do the billing for the doctors. But we don't approach the doctors. We don't do medical billing. We're not your competition. I hope that answered that question. Okay, let's move on here. Let's see. Of all the physician practices, that's practices that are 1 to 5, with employed billing staff, hope to outsource their billing in the next 12 months. Now, folks, that's from a website. You can see it. I know it's tiny. I'm sorry. It's called blackbookrankings.com. See it right there? And that means that of all the physicians' practices out there, there's a huge percentage of those that want to outsource their billing in the next 12 months. The exact percentage is right there to the left. You see it right there? It's 42%. Now, folks, that's almost half of the doctors, it means, that are using their own staff to do their own billing right now are looking to outsource it in the next 12 months. Now, talk about a window of opportunity for you. That is a beautiful window of opportunity. Okay, let's see. I'm trying to keep up with the questions here. Mark says, are there protected territories or is it open? Mark, it's wide open. We're not a franchise. Franchises limit you, like if you open a Subway sandwich shop, you're limited to like 2 miles radius before they can open up another one. You're not protected at all. In our business, we look at it this way. Let's say you sign up a doctor in your city. That doctor loves what you're doing for them, and they want to refer you to another doctor that's in another city or another state. You don't want to be limited, right? So there are no territories. It's wide open. Believe me, there's enough medical entities out there that you can bill for that keeps all of our licensees scrambling to keep up with it. Look at this quote. Market analysts estimate that I got the word that twice there, don't I? That 24 cents out of every dollar are wasted on administrative and billing expenses. Now, folks, think about it this way. You, as an ABS licensee, and this is true with most billing companies that are out there doing billing for doctors, they'll charge anywhere from 5 to 8%. That's a good range. Not many people are billing for less than 5%. Not many people are billing for more than 8%. There are exceptions, of course, to every rule. But think about it this way. You're only charging, let's say it's 8, that you're charging the doctor 8%. Look what he's spending now. Yeah. He's wasting 24 cents. That's 24% that he's paying right now for handling all that inside of his own office. I'm trying to keep up with the questions here, and I think I've done a fairly good job with answering everybody's. If I skipped yours because I'm deleting them here as I go along, just type it in again. Play like I'm just senile and overlooked it. Okay. Look at this quote now. This is a doctor that appeared on U.S. News cover there, Dr. Vern Cherenwatinko. He is a family physician, and here's what he says. To get paid by the insurance company, I have to pay about $20 in administrative fees to collect it between the person, he's talking about his staff person, that does the billing, the computer system, the ongoing support, et cetera, et cetera. It costs me, he says, about $20 per claim. Now, folks, let's say the average claim in a general practitioner's office, like this doctor, let's say it runs $100. I'm just using round numbers to make it easy. $100 and you're charging 8%. Isn't that just $8 you charge the doctor to do the billing? Yes. Well, look what he's being charged right now, or what it's costing him to do it with his own staff. Folks, there's lots of hidden overhead, not just for the people's salaries and benefits and vacation and all that, but the software itself. There are update fees from some software companies that are hundreds of dollars a month. And to keep a system running on a network in your office takes an IT person that costs sometimes $500 to $1,000 a month. So it's very expensive for a doctor to do this in their own offices. That's the whole point of that. Now, here's the annual cost, in fact, in a doctor's office. We've done a comparison here in-house. If the doctor uses his own staff to do the billing, based on the numbers you see here, you can review the handout there later to get the details on this. But here's what it boils down to. With all the costs that it costs for a doctor to pay for his staff, all the training costs, his errors and omission insurance, his leave, benefit packages, hardware, software, IT support, all of that is going to run a doctor $65,000 a year. Well, if you were doing that same billing for this doctor at 6%, he would only be paying you $28,800. You see the difference? You see why it doesn't make sense for a doctor to keep it in-house? It does not make sense, and that's why a lot of doctors are wising up, and that's why 42% of them are looking to outsource next year. All right, now, if you're wondering what kind of money you can make, you can actually find this on our website. I've taken a screenshot here of our website, and under, right here, income potential, you'll find this little calculator. Now, it already has some numbers in there, so let me tell you what the numbers mean, and you can put your own numbers in there, of course. Let's say that you wanted to have just one doctor. That's all. Let's base it on just one doctor, and you can do the math in your head if you had, 5 or 6. If that doctor was seeing an average of 20 patients a day, and folks, I've been in the waiting room when there were 20 people in there besides me at the same time to see the doctor within the next hour. So we know a doctor can see a lot of patients a day, but just 20 a day. If you, and assuming that the office is open 5 days a week, if you were charging even as little as 6% of an average claim amount of $100, let's hit the submit button here and you'll see that you could be earning, can you see that number right there? It's kind of tiny. I'm going to throw it up here on the largest slide in just a moment. It's $31,200 a year. Yeah, again, I told you for one doctor you could make from $30,000 to $40,000 a year. Depends on what you're charging, of course, and how many patients they have and how many claims and what the average claim is and so forth. But folks, that's $2,600 a month or $31,200 a year that you can do sitting at home in your, pajamas. Because, again, most of our licensees have not opened up commercial offices. They are working out of their home. You see, the doctor doesn't come and visit you in their home, and they don't care. Nowadays, folks, do you know how many home offices there are out there providing services for all kinds of businesses? This is the trend, people starting businesses in their own home. And it's a wonderful business because you can move, you can go to another state, it doesn't matter. You're continuing to do everything through electronic means over the internet. It's all electronic. There's no paper involved in it, so it's a wonderful business. David says, so excited to see these numbers. Hey, plug in your own numbers, David, and see what you could come up with because we've got licensees now. Remember, I just showed you one doctor can make you this kind of money, $31,200 a year. We have our average licensee probably has less than a dozen doctors, to tell you the truth. But we do have licensees who have over, are you ready for this? 300 doctors. Yeah. And you can talk to some of those licensees. We'll give you their names and phone numbers, folks. Don't take what I say on these webinars as fact. We'll let you talk to people who've done their due diligence on us as a company and this industry. They've come down here for our week's training. They went home and they started their business, and now ask them the questions. Ask them, and they'll tell you the facts about it. We don't tell them what to say. In fact, sometimes we rotate through people because they get tired of taking so many calls, but the point is you can call a lot of people and ask them about it. Okay, now let's move on to the next slide here. Hey, I mentioned earlier that there were other streams of income. Let me briefly go through some of those. Now, I'm going to start here with, these are some of our marketing brochures. I'm going to start here with iClaim itself. iClaim, of course, is our branded, private label system. Nobody else has it but you, ABS licensees only. This is not marketed directly to doctors like some companies do out there. They'll sell it to their licensees and then they'll sell it to doctors direct. We don't do that. It's a cloud-based billing system, like I said, that runs on any platform that's connected to the internet anytime, 24/7. And it's a wonderful device, folks, because as you can see, we can actually connect you and the patient and the doctor all into the system. We have a patient portal. That's what you're seeing here up in the upper left-hand corner, where the patient can go online and put in all the demographic information. And then when the doctor sees the patient, it's already in his iPad or tablet that he's using there to do his electronic health records visit with the patient. And then that all goes into the billing system. So it's all inside there using our cloud-based system. And then, of course, the claims are sent directly to the insurance companies for payment because, again, there's no clearinghouse involved. Remember, we have our own integrated clearinghouse, illustrated here by this graphic. That's our clearinghouse inside there. Again, other companies are going to have to force you to send it to a clearinghouse who then has to look at it and they decide whether they're going to pay it or not, and then they'll send it back if it's rejected, and you got to figure out what's wrong, and then you got to resubmit it again, and so forth. Ours doesn't have that, folks. That's why our rejection rate is less than 2%. Okay. Oh, here's a great quote. Look at this. This is from the American Academy of Professional Coders. Industry experts have found that the average number of rejected claims for a medical practice averages around 34%. There you go. If you want figures, there's a good figure to know that most doctors are having a 34%. That's out of 100 claims submitted by them or their current billing company. 34% of them are rejected. Now, folks, compare that to our 2%, and you'll see why we can save the doctor a lot of money. All right, let's move on. Here's another one of the parts of our system is, of course, EMRX. That stands for Electronic Medical Records. And, folks, this is a wonderful system. It can be used on any computer, of course, but it's also, again, designed to fit on the iPad. Now, let me see if I can actually do this live here. I probably have logged out already, but let me see if it's, yeah, here it is. This is the system. I'm going to show it to those folks who've actually seen the video. Those of you who are watching the recording, I'm sorry, but I'm showing it on my iPad here. So the doctor can actually push buttons here on the iPad and go through the system step by step, find out everything they need to know. They can, I'll select one of these patients right here. I'm trying to look at my laptop here to show what's showing. There you go. You see? This is, the doctors are blown away when they see this demonstrated to them. And folks, we'll do live demos for your prospective doctors. We do the demos. We answer all the doctor's questions. This is all a part of your licensing fee. Let's see, David says, with your software, can the business be self-running if I hire virtual assistants? Yes, David, we have people who started out doing the billing themselves, of course, because they wanted to know, what it's all about. Then they hire people to do it for them, and those people can be located anywhere in the world that has internet connection, because again, it's a cloud-based system. Keep the questions coming, folks. This is great. Now, our system is secure and it's all certified. We'll give you all the details you want about that, folks. You don't have to worry about it. It's HIPAA compliant, which means the government has looked at our system and said, yes, it is as secure as anything that's out there. And it's also been approved by the American Osteopathic Association, the American Podiatric Medical Association, and all these other people that you see here on the screen. Like I said, it's designed for the iPad. It's certified for meaningful use, and it has things like drawing tools. Yes, the doctor can, with their finger, draw right on the preloaded graphics of different parts of the body, or they can upload a picture of the patient's actual foot and make notes on it there. It is mobile compatible, which means the doctor can actually access it from any mobile device. And of course, it has e-prescriptions built into it. Nowadays, the doctor can literally see the patient, push a couple of buttons, and before the patient walks out of the office, it's at their pharmacy waiting for them to go pick it up. And get this, guys, you talk about cool stuff. This has voice transcription built into it. The iPad has a little, when the keyboard pops up, there's a little microphone next to the space bar. When you tap the microphone, you can just talk. As you can see, we tested it out here, and as you can see, we were actually saying verbally, the new iPad allows you to dictate notes directly into whatever application you're using. Here is Microsoft OneNote, for example, and the dictation seems to be going okay. So anyway, the doctor never has to type anything in. Now it's all just voice. And get this, folks, this is the latest. This is big out there right now. There are companies who are selling franchises for people who want to offer e-visits, we call them, telemedicine is how it's referred to sometimes in the industry. But folks, built into our system, the doctor can actually see patients visually and talk to patients right on his iPad from the computer that the patient is using in their home or their own iPad. Yeah. Anyway, this blows me away, folks, because this is the future, believe me or not. There's a lot of visits that you make to a doctor that didn't need to be you physically sitting in front of the doctor, right? So the doctors can actually charge for this as well. It's somebody asked if it was legal in one of my webinars. Yes, it is legal, or we wouldn't have it in here. Okay, Shirley is asking a question. How would it take, I guess she means how long. How long would it take to get a doctor set up? Well, think about it this way. There are some things that have to be done with the insurance companies to make sure that the insurance companies are okay with you doing the billing. So it's really just paperwork back and forth between the insurance companies. Most people can get the doctor set up within 2 or 3 weeks at the most. And folks, it depends on whether or not you're talking about, you don't have to put all the patient's information in there that the doctor sees. It's just that as new patients come, you're going to get that information from the doctor's office, all electronically, no paper. It's all sent to you electronically, and you'll be putting that into our system. Now, some people actually buy 2 monitors, have 2 monitors connected to their computers. All computers can do that nowadays. And so on one screen, you could have the fax or the electronic document that's sent to you by the doctor's office, and you're looking at that on one screen. On the other screen, you're actually putting it into our system. So again, we eliminate paper completely. Paper is gone. It's old-fashioned. We have real-time reporting. Here I mentioned earlier that the doctor get reports. You can provide these for the doctor or give them access to this part of the system so that they can see their own. Look, so when you bill the doctor at the end of the month for what you're going to bill him, let's say you're going to bill him 7% of the money you collected, here's the numbers right here. You just take the number and you tell him on your invoice that you can go and find it in our system or print out the report. That's what I like to do. I would do that if I were actually billing for people right now. Print that out, give that to the doctor with their invoice, or send it to them electronically as a PDF. And there, they have no question because this is in real time. This is in real time. Okay. Also, I mentioned earlier the eligibility check. Look, all you have to do is have the doctor's office get from the patient when they walk up their provider ID number, their payer, their insurance number that's on their insurance card, right? And when the doctor's office puts that into our system and pushes the button, our system in real time over the internet goes out to the insurance company's database, grabs the data for that particular patient, and imports it right into your system and lets you know whether or not that patient is eligible for that visit or not. This saves the doctor a lot of time seeing patients maybe that are not eligible, that he's never going to get paid on that claim. And it just saves, believe me, it collects a lot more money from the doctor because of that. Okay, we got to move on here. Wow, it's 38 minutes after the hour here, and we're talking about now auto card. Guys, this system that we came up with is fantastic. These are full-color marketing postcards. Yes, printed cards, not electronic, that go in the mail to the patients to remind them of their visits. These are cards that are designed for you to use inside this online system. This system, by the way, has over 18,000 cards already built into it. But you can personalize every one of these cards for the doctor's particular practice, including pictures of the doctor, their staff, their building, whatever. And these go out automatically once a month to the patients or to your prospective doctors doing automatic marketing for you. It's a wonderful system that has made a lot of our licensees a lot of money. Ask your ABS rep for more information about that one. Choice Pay is a wonderful system that allows the doctor to collect from patients. Yes, you're a patient. No, you don't ever pay every bill from the doctor right when it comes in the mail, right? Sometimes that goes to the bottom of the stack. I asked a class one time, what do you do with those bills that come from your doctor? And one guy says, well, it goes in file 13 until I get a third one from the doctor. But anyway, the point is, look at this quote here from McKinsey and Company. They say that physicians typically collect only 50% of their outstanding patient balances, results in $60 billion in bad debt annually. Now, folks, we have a system that has been proven nationwide to collect up to 41% of all that 50% that was not collected. And it's automated. You never pick up a phone. You never have to lick a stamp or send a letter out in the mail. It's completely automated. This is a wonderful system that the doctors love when you present it to them. Now remember, all of these services are included in your licensing fee, by the way. There's no extra charge for any of these. In fact, we've come up with some of these in the last 2 or 3 years that we didn't have, and we don't charge anything extra for our licensees. Once you become a licensee, folks, that's a one-time, lifetime licensing fee. You never have to pay anything more than that to us. Quick Collect is another service that allows us to go back and automatically, online, again, it's automated, go back and collect the money from the patients using letters that come in the mail that are generated by us and sent. You don't do any of this. And the first letters that go come from the doctor themselves. And then if the patient doesn't pay and the doctor wants to, we can have it come from an attorney. Anyway, that's why you're not a collection agency. You don't have to get on the phone with little Miss Smith and say, hey, where's that $20 you owe us this month on your medical bill? That's all handled electronically. All right, let's move on to another one of your services that you can offer. Audit Guard. Now, folks, I don't know how to explain this other than to say this. Doctors sometimes don't know what they're doing with those codes. Sometimes they're over-coding. They're charging for a visit that was not the level that it should have been. Maybe they're charging it as a level 5 when really it was a level 3. They can get in trouble for that. You've probably read articles in the newspapers about Medicare fraud. Yeah, if a doctor, let's say, sends all of his claims in at level 5, Medicare knows that they're not all a level 5. They should be a level 1, 2, 3, 4, and 5, a mixture of those. So Audit Guard's a service you can offer to that doctor to make sure that that doctor doesn't get in trouble, because they can be fined up to $10,000 for every one of those codes that are wrong. That's right, you heard me right. The doctor can be fined $10,000 for every infraction of those codes. Well, with this service, we have certified medical coders that can do an audit of some of the patient's records in the doctor's office, not all of them, just a section of them, and find out whether that doctor could be in trouble if they were audited. This is a wonderful door opener that you can go in and sell to any doctor, and you can make a lot of money on just offering this service here. But it's a wonderful door opener for you to offer to the doctors, or along with your proposal for medical billing. CodeRack ties in with this in that this is the same certified medical coders who can look at the doctor's current codes and make sure that they're using the correct code. Sometimes we increase the doctor's revenue by up to 30% by just reviewing their current codes. And again, these are online reports and things that can be provided. Codes, as you know, again, they're just numbers that refer to what the doctor did for this patient. These are diagnosis codes here. There's hundreds of them. And folks, there's some new codes coming out next month, October 1st. A whole new set of codes are coming, and a lot of doctors are not prepared for those. A lot of software, by the way, is not prepared for those codes. That's all been in our system for the last year. We've been updated and ready to go for the last year. Let's see. Okay. Here's a good question. David says, because of the proven record, why does AB Systems need outsourcing instead of directly with doctors? In other words, I think what you're asking, David, clarify this if I'm not reading this right, is you want to know why ABS doesn't just go out and sign up all the doctors in the United States ourselves. Well, first of all, we don't want to do that. We're a local company here in Fort Worth, Texas. We've been here 21 years. It's family owned. It's a private company. And folks, we just don't want the headaches of having to deal with sales reps or whatever all over the United States. And doctors need to be approached. We teach you how to do a practice analysis, which I'll talk a little bit more later about. But you get the information from the doctor, take it back, put it into our system, it generates a report that shows whether you can help the doctor or not. So it takes somebody local. Besides, the doctors don't want to deal with somebody, if they're in New York City, they don't want to deal with somebody in Fort Worth, Texas. They want to deal with somebody right there that's close by. Okay, let's see. Here's Mark says, who owns the customers, ABS or us? You do. Mark, we basically put you in business for yourself. So your clients, your doctors are your clients, not ours. We know nothing about those doctors other than what you put into the system for the doctor. Let's see, he says, what if we decide to do something else? Do we keep our doctor clients, or does ABS? Data is in the cloud, which I assume are ABS servers. Yes, that data is on our servers. You're correct in that. But David, Mark, those are your clients again. A lot of our licensees have moved on to other things in their life or for other reasons needed to sell their clients. So they sell those clients. They don't give them away. They sell them to somebody else who's going to take over. Usually it's in their local area. We can even help you find those buyers for those. But those are yours. Or you can just pass it on to your children or other relatives to run the business for you. Okay, here's Robert says, do any restrictions exist with billing to CMS or TRICARE? No, those are federal agencies. Robert, you're correct. And no, you bill for all those Medicare, Medicaid, and so forth. Here's Robert says, does the system crosswalk ICD-9 with ICD-10? Yes, here's the great thing, Robert. Our system can actually show the doctors two different buttons. When they're looking at the patient, visiting with the patient in our electronic health record system, they can push a button and see what the ICD-9 codes are that they can select from. But if they want to, even now, before October 1st, they can push the ICD-10 button and see what other codes are now available, because those codes are expanding from something like 16,000 codes right now to over 68,000 codes. So they've got codes for all kinds of weird stuff. Look it up online, just Google it and say funny ICD-10 codes. One of them is you were hurt by a fire that caught on your water skis. As if that could happen. I don't know. There's all kinds of weird stuff out there. Yes, it does interact between those two codes. Let's see. Will ABS help in marketing the service? Yes, I'm going to get to that here in just a moment. Emailing. I'm not pronouncing that right, probably. And then, of course, David says, I guess this was in response to what Mark asked there. He says, give those clients to me. Well, he might sell them to you, David, but he wouldn't give them to you. Okay, oops, I went past that slide. Let me go back. Here's another great quote. The average physician could increase their monthly billing by about 30% if their medical coding was done accurately. That's why it's important that you have code right. There are reports that you can provide for the doctor, of course. That's all a part of this service that you, again, charge the doctor for and make money on, of course, as well. All right, let's move on to the next one here, iDocs Now. Now, look at that picture on the screen. You see all those files? You've seen those in the doctor's office, right? They're in those file cabinets right there behind the counter. Those are the current patient's data. Now, what does the doctor do if he gets involved in electronic health records? Well, as new patients come in, they start putting the data in so that it's stored electronically. But what about all those files behind there that have already been put in the past? Well, iDocs Now is a system, it's a cloud-based system, again, that the doctor's office can scan all of that into the cloud and access it from any computer or internet-connected device anywhere in the world. It's a wonderful system that all doctors' offices need. Hey, I've been down doctors' hallways where there are boxes of these things that they don't know what to do with. It's very expensive to store these types of files. They can't just get rid of them. They have to keep them for at least 7 years when a patient first visits them. So we can solve that with iDocs Now. It's a wonderful system that's think of it as an electronic file cabinet. But every file, once it's scanned in, can be accessed by anybody in the doctor's office. Yeah, this is one of the systems that you can use to get that data from the doctor's office to you. You'll have an iDocs Now login, and the doctor's office will have one. And when they scan stuff in, you just go in and get it each day and look at it. That's why I told you earlier it'd be nice to have two screens. But the point is, you can search those files by any keyword in the file. Yeah, it's called OCR, optical character recognition. Every file scanned in can be searched. So you never can lose anything. It's always there, and of course it's backed up nightly on different servers. So very, very, very nice system for people. Again, the doctor's office scans it in using a simple little inexpensive scanner. It goes right into the system. This is a screenshot of the iDocs Now system, and there it is. If somebody's just scanned this one document in, and it's a fantastic system. Ask your ABS rep more about it, or go to our website and read more about it there, especially in our e-tour virtual brochure. Now, folks, somebody asked earlier about marketing. I know this is one of the scariest parts of starting any business, right? Not just this business, but any business you start, you've got to figure out how to get clients. Well, folks, our marketing techniques are 21 years in development. These have been proven and tested by hundreds of people from coast to coast. We know that they work. And we teach about a dozen different ways. I'm going to cover some of them right here, but first, I got to get back to some of the questions. Here's Shirley saying, to get the doctors, do you have some salespeople that we can call? Well, we're going to talk about salespeople here in just a moment, Shirley. What hours is your support services available? Support for our system is available from like 7 a.m. Pacific time to 7 p.m. Eastern time, or maybe I have that backwards. Anyway, it's a big chunk of the day. Let's see. Tony says, Patrick, I imagine iDocs isn't unique to just ABS, right? No, iDocs now is, again, our private label system. Now, there are other systems out there with other names, of course, that do something similar to iDocs now, but this is for our licensees only, Tony. Let's see. Mark says, this might sound really stupid, but is anyone using this system with vets? It seems very insurance focused, but vets have to bill customers. Oh, vets. I was thinking people who've been in the service. No, you mean veterinarians. And no, it's not used with veterinarians. You're right. Those are usually private pay, not based on insurance. And of course, they're not human beings either. Well, the vets are, but not the animals. Is there, here's Kathleen says, is there a fee per physician for iDocs, or are we licensed to use it with any of our doctors? Yes, there is a fee that you are going to make a proposal to the doctor for here's what it costs for him and his staff to access the system. There's unlimited users, but there is a monthly fee that the doctor is going to pay depending on their volume. Again, I can't get into the details of that here today, Kathleen, but ask your ABS rep more about that, and we'll give you some more details about that. Or, again, it's on our virtual brochure there. Okay, so let's talk about some of those marketing tools. Folks, we have spent literally over $500,000 developing our marketing tools. Now, that's why our licensing fee, even though it's $25,000, is a bargain. Because if you had to recreate all that we've created just on the marketing tools alone, not to mention our licensing website, I'm going to show you here in a moment, and our lifetime support and our live training here in Dallas, all that's included in that fee. But the marketing tools alone could cost you a lot of money. So let me just talk about some of the other marketing things that we're going to teach you about and provide to you. We provide you with a website. We're going to show you how to do web marketing because you need to be on the internet today, of course, to look like a valid company. So we're going to show you how to set that up with emails and all that type of stuff. We'll also show you what social media you should be using. Some of it you should be using, some of it you should not be using. Again, from our 21 years experience, we know what works out there in the world of not just business, but in the medical world. We're going to teach you to do business networking to show you how to connect with other business owners in your community that know doctors. People know people, right, who know people. And we're going to show you how to connect with those in a very professional way. I ran a business networking group here in the Dallas-Fort Worth area for years and can tell you how to do that. Email newsletters. We're going to show you how those automatically can stay in touch and keep your company name at the top of the mind of the doctors and the office managers by using automated emails. We have automated follow-up systems that do all of that for you, including using direct mail, phone, various documents that you can email to people and that type of thing. This is all automated, folks. That's a part of your ABS licensing fee as well. We'll show you how to do educational marketing using the book I showed you earlier that I wrote along with a CPA friend of mine. On educational marketing, we call it. We're going to educate the doctors who don't understand why they should be outsourcing with this book. By the way, you can get a copy of this book at any major bookstore or on Amazon.com. It's $14.95. Or if you ask your ABS rep for them, they'll probably send you one as a PDF at least, so you can get a feel for what that book's all about as well. We're going to show you how to do trade show marketing, folks, not just medical trade shows. There's lots of trade shows out there and conventions going on probably this week in your city that you should be at. Excuse me. And folks, this is a great way to market because you can see you stand around and people come up to you and start asking you questions about what you do. We have the booth that you see there already designed. In fact, we have a tabletop and a full-size booth that you can borrow anytime you're setting up a trade show. just schedule it with our support department. We'll ship that out to you, and you can use that to draw people to you. Notice it has nothing to do with ABS. There's no company name on there. This is very generic. You'll brand everything there at the trade show, of course, with your own company name. I mentioned earlier live demos. Now, I've tried to illustrate it here with this picture. I don't know if it does it justice, but folks, basically we set up a demo using this technology that we're using today to do the webinar that shows our system live to the doctor. See him in the bottom right-hand corner there? Now, you can be on the webinar yourself on your own computer, or you could be in the doctor's office watching and listening to us there. We do the demo showing the doctor the advantages of outsourcing their billing to you. Folks, about one half of all the doctors who see these demos that we do for you at no cost sign up. Yeah, that's how powerful this is. Sorry, I muted there just for a second. I hope y'all can hear me now, and I'm back. Okay, let's go through some other slides here. Here's the eligibility request. We're just showing you there how that is shown to the doctor live during the webinar. We're actually in a live system, not just screenshots like you're seeing here, but live. Somebody asked earlier about sales reps, folks. We have an entire sales rep program already designed. We'll show you how to find these people. Believe it or not, there are people who love to go out and call on doctors, right? They're already selling sometimes pharmaceutical, medical equipment, cotton balls, rubber gloves, that kind of thing. We're going to show you how to find those people and help them find clients for you. Sometimes it's just for a referral fee. Sometimes it's on a commission basis. You'll give them a part of the setup fee that we charge to doctors to get set up. And then, of course, you can also pay them on a monthly basis, a percentage, a small percentage of the money that you collect for the doctor. A great incentive. That doesn't have to be forever, of course. That can be just for a year at a time or whatever. But we've got licensees who've used sales reps to get them clients all over the United States. So we'll show you how to find them, hire them, train them, and pay them. We do, basically, and we teach you to do this too, and you'll teach your salespeople, of course, to do what's called consultative marketing. Now, folks, this is unlike anything you've ever heard of before from a marketing standpoint. Those of you who've been in business for yourselves or have a background in sales, you kind of are disadvantaged. Yeah, because you're going to have to unlearn about half of what you know from a marketing standpoint. We're going to show you how to go in and actually consult with that doctor's office and position yourself as a certified medical revenue manager. Remember, you're not just doing the billing, you're solving all of their medical revenue problems. So we're going to show you how to do that through what's called the practice analysis. Now, this is a simple it's 3 pages, even though it shows 2 here now, questionnaire that you'll go through. You'll sit with the doctor's office, or usually the office manager, and ask some questions like you see here on the screen. It's about 30 or 40 questions now that we've come up with. Once you put all that together, you take it back to your office and put it into what's called a proposal. It's a very professional templated proposal that we've prepared for you, and we'll review with you to make sure that you've priced it right, at least for the first few times. And you'll go back and present it in a very professional folder. You see there on the left. There it is, open on the right-hand side there, maybe with some of the brochures inside of it. And it goes step by step through what you are going to do for the doctor and how much money you can save them by outsourcing it. The licensing fee also includes, of course, our 5-day live training workshop. I mentioned it just briefly, I think, at the beginning here, but I'll show you more about that here in just a moment. We hold those about every 6 weeks or so, depending on how many people have signed up for those, and we do it at a Marriott Spring Hill Suites. Very nice place. They provide breakfast for you. We bring in lunch each day. It's 8 to 5 every day, Monday through Friday, well, except for Friday. At Friday, we let you out early so you can get a flight and get home at a decent hour. But it's a lot of information that we're going to be cramming in during that day. The workshop agenda I'm going to put on the screen here, although I don't have time to go through every one of these things, folks. Believe me, there's a lot of data that's covered here. You can't learn everything you need to know about this business in even 5 days, but we're going to give you a ton of information, enough information for you to get your business started and get your first client. And that's all you really need, right? The rest of it will be learned on our licensee website that I'm going to show you here in a moment. And you'll have access to that forever. It's a lifetime access to it with no charge at all for that. Certified instructors, folks, we actually bring in licensees. This lady that you see pictured here is Cynthia Anderson. She is actually our current lead instructor. She flies in, and we pay her to do this training while she has her people that are working for her in her office back in her home state to do the billing for her while she's gone. We want you to learn from somebody who's actually out there doing it themselves and have built their own business. So that's why we do that. We bring in laptops during the training and have you actually doing medical billing, hands-on training, folks. This is unlike anything you could ever get over the phone with somebody or through a correspondence course. We're going to have you doing medical billing, you and a partner. If you don't bring somebody with you, we'll have somebody partner up with you. And you guys will actually be doing medical billing by the end of the first day. It's not brain surgery, although you could be billing for a brain surgery. Then, of course, I mentioned earlier our lifetime support. Now, I'm going to show you, this is a screenshot of our licensee support site. We very rarely show this to people who are not our licensees, but I wanted you to actually see it. So I'm going to click on it here, and I think I'm still logged in. I'm going to find out real fast here. Yeah, okay, so as you can see, I can click around here. This is a live shot of what's really going on this website. I'm going to increase this. I think I can do that so you can see it a little bit better. There we go. Yeah. And as you can see, folks, there are dozens and dozens of video trainings, tools, documents, just lots of stuff on this, folks. We cover everything in detail, step by step, and you have access to this constantly. Folks, here's the news tab. When you first log in, you'll be looking at this. As you can see, we post things on a regular basis and have since September of last year when we started this blog. So there's literally hundreds of posts. Here's one that we just posted, as you can see. What is that? The 8th. That's yesterday, right? And then we have others. If you go down there, I mean, there's lots and lots of stuff here. Every one of these things goes somewhere else on this site to show you a video. Here's let's see. Here's a direct mail overview video. All right, I'm going to click on that. Let's see what happens here. That takes us to the direct mail overview video. There it is. Look, I can hit the play button and play it right here. So you don't have to download anything. It's all right there on our website. There you go. Ready for you to actually play right there on your computer. So I wanted just to show that to you. Let me get back to my slides here. And I'm going to take another question here. Here's from Mark. Are these webcasts archived? I might want my wife to run through it. Yes, good question. Mark, we're recording this right now, and we usually post it by Monday of the following week at the latest. But we'll send an email out. Just check with your ABS rep if you have one that you're working with here at our office, and they'll get you a link to this so you can go watch it. It's on our website. Let me see if I can show you. Let's do this. I'm going to go back out to the Internet Live here, and I'll go to our, oh, I typed that wrong, absystems.com. So here's our website that you probably started learning more about us. And if you'll notice right up here under News, let me enlarge that so you can see that a little bit better. Under the News tab, well, the menu's changed over here now. It's over here. There it is, News. There's a little link to our blog. Well, on this blog, on this main website, you'll see that we've posted all of the webinars for years back. This goes back, oh gosh, it goes back a long place. So you can view all of those right there. This will be posted. This very webinar will be posted here, Mark, within the next few days. Okay. Kathleen says, I'm sorry I dropped out for a minute. Is there a cost for the week-long training in Dallas? Well, that's included in the licensing fee. And again, from our website, you can go and actually find out more about that on the website itself. Our licensing fee for this business opportunity, this like a franchise, right, is $24,990. Now, I know that sounds like a lot of money to a lot of people if you've never looked at businesses that are out there. But this is a very inexpensive business to get into, folks, for the potential that the business has. Oh, I just clicked on something I shouldn't have there. Let me do this one more time. And I'm supposed to click outside that. There we go. Okay. We also have a training site for the system itself that not only you can learn from, but your doctors and the office staff can learn from as well. So as you can see right here, There's all kinds of help and tutorials about everything, frequently asked questions, training videos, live webinars are provided for you and the doctors. Folks, this is all included, lifetime unlimited support. Think about that. There are companies who include a year or maybe 2 years of support for their business opportunity, and then they're going to charge you so much a year, some kind of membership fee or something. We just don't believe in that, and we don't do that. It's all included. I mentioned, by the way, earlier that we are members of the Fort Worth Better Business Bureau. I took a screenshot here of our rating of A+, but I have a question every once in a while come up about this statement right here. Can you see this? This business is not BBB accredited. So as I wrap up here today, let me just cover what that means. Now, this is from the BBB's website, and it explains what accreditation is. Businesses, it says, are under no obligation to seek BBB accreditation, and some businesses are not accredited because they've not sought BBB accreditation. Folks, that means we haven't joined the Better Business Bureau and paid their $1,000 a year fee. Why haven't we done that? Well, let me go back to the previous slide. We haven't done that because we have an A+ rating. The only reason anybody would ever do that is they want to support the Better Business Bureau, which we have in the past. But folks, there's just no need to be a member when you've got an A+ rating. It doesn't get better than that. And if there were complaints from the public, believe me, it would be posted here on the Better Business Bureau side. Anyway, I wanted to cover that so people understand what that accreditation is all about. And finally, folks, if you didn't know this, we have a 100% money-back guarantee. Look, I know this sounds crazy. We let you come down to our week-long training here in Dallas, sit through the whole thing, learn everything there is to know about this business, and then at the end of the training workshop, you go, you know what? This is not right for me. You can ask for all of your money back. Every penny of your money is refunded in full. We don't keep a dime of that. Now, how do we do that as a company? Well, we must be pretty sure of what we've got, right? It has been, we have had some requests for refunds, 3 or 4 maybe in the past 21 years. But folks, that's the only way I knew to help people realize that this is real. It's only when you come and see it for yourself that you can wrap your brain around it. Bring your spouse with you. For another $995, we'll let them sit in the classroom as well, as long as there are seats available. The classroom only hosts 20 seats, so we have to limit that, but we will let you bring your spouse so that they can see it as well. Okay, Osama says, what's the average time for new startups to get at least one doctor office? It's somewhere between 30 and 90 days. That's the average. Now, there have been people who've taken longer. Maybe they're working a full-time job and they can't devote full-time to this, and it might take longer than 90 days. But we have had licensees leave the training and go out and get their first client in the next week. David says, ABS is practically holding our hands till success. What a great company you've created, Mr. Phillips. Thank you, David. I appreciate that very much. And Osama says, what's the successful rate of your customers like us? I get that question from time to time, Osama, about what is your success rate? Well, first of all, define success. For some people, success is having 300 doctors. For others, it's having 1 or 2 doctors, just enough to make some extra money. Maybe they don't want to do this full time, or maybe they can't do it full time. Maybe they're handicapped. Maybe there's a reason why they don't want to build it beyond, and they don't want to hire employees and so forth. So you can keep this as small as you wish or make it as large as you wish. That's always up to you as an individual, of course. Okay, our next training, I'm going to wrap up here, and I'll see if there's any other questions coming in also. But that's it for today, folks. I've tried to be as straightforward about everything as I could. We only have 6 seats open in our next training class. That's 2 weeks from this Monday. So if you wanted to get in this, you've got to get your due diligence done, talk to some of our other licensees, make your reservations, and just get down here. If it's not for you, you can get all your money back at the end of the week, so there's no risk on your part whatsoever. You can call our 866 number. That's a toll-free number that you see at the bottom of the screen there. If you're not talking with somebody currently, go back to the email that came telling you about this webinar. It probably has somebody's name at the bottom. Ask for that person and talk to them about it, and try to get your reservation in for the workshop. We hope that you enjoyed the webinar today. Folks, we do this every Wednesday. If this training is too soon for you, maybe you can't come until October. I don't think we have one in November, but there is one in December, I think. So we only have a couple of trainings left. This is the time to get in business for yourself. Healthcare is the business to be in, folks. I hope that you'll take time to research this thoroughly. Let me just say this face to face with you. My wife and I started this because we wanted to help our family, and we have a family business. Our children, our son is almost 40, our daughter's a little younger than that. They're both involved in our business still. It's a wonderful family business to be in. We did this because we wanted our own family to be in business for ourselves and successful. But folks, we started training and teaching other people how to do this because we know that it's important in today's world that you not depend on somebody else. Your only security in today's world is owning your own business. That's the only thing that you can know for sure that is going to be secure for you and your family to have a future with your own business. So if this business is not the right business for you, keep looking. There's something out there that would work for you and your family, like this one has for our family. Well, again, thanks again. I'm going to put that last slide back up so you'll see our phone number and the dates of the next training class, September 28th through October 2nd. Again, that's 2 weeks from Monday, so I hope I see you there. If not, be on the next webinar, which is, again, next Wednesday at 3 p.m. Central Time. My name is Patrick Phillips. I'm the founder and CEO of the company, and I love this business even after 21 years. I hope you can tell that. And I want everybody that gets involved in it to be as successful as we were. Thanks again for joining us today. Bye for now.